Hey, how are you guys? All right. Oh, I think we're live, so we're good. If we cut out tonight, just stay on. A lot of times it is more just the connection on your end. I'm going to continue the broadcast because then when I go back to repurpose this to put it as a forever video for you guys on Meet On, it'll be fine. So just bear with us for that. My name is Sarah Tugender. I'm a national field manager with nutraMetrix, hoping that this is your most effective and efficient year yet with nutraMetrix. Tonight, we're going to focus on the clinic walkthrough, and I'm going to do a live clinic walkthrough with you guys. It's going to be really fun. I have here Dr. Witkowski from Melrose, Massachusetts.
Hello.
How you doing?
I'm great.
Dr. Witkowski, what is your specialty?
I'm an obstetrician gynecologist.
Or do you just play one on TV, or are you a real obstetrician gynecologist? No, this is the real deal, guys. So, full disclosure, yes, this is my dad, the famous Dr. Witkowski that I often talk about in a lot of my meet-ons. And he was gracious enough after hours at 9 p.m. as we're strategizing implementation in his office to walk us through as if we are a patient.
Right.
I have with me, and I recommend that you guys do this, is I literally have, you guys can see, the clinic walkthrough form. If this was a real live clinic walkthrough, I would probably have this on a clipboard and I would be taking notes. I'm going to bring this around our clinic walkthrough just as a reference guide. So the first thing is, so Dr. Witkowski, I usually start here in the waiting room. So can we just like step aside? We'll just show them your very simple and modest waiting room. You actually share, as we can see, all the way down the hallway.
Yeah.
So you are the last suite here in this waiting room. So so here they would sit. Now, because you're an obstetrician gynecologist, you have a blend, right, of people, because sometimes
they're pregnant women, and sometimes it's just someone for a GYN visit.
And sometimes they bring a friend.
Sometimes they bring a friend or their mother or their husband.
Right. Yeah. So
or their family. Sometimes there's kids.
Yeah, it's a busy waiting room typically. So I usually do these clinic walkthroughs like this, either before hours, after hours, or over lunch, when it's empty, just like this. So we're noting here, I like to just make notes. So as I'm going through, there is a magazine rack, but otherwise there's kind of nothing going on. So, Dr. Witkowski, are your patients, are they conditioned? Do they do something when they first come in, or do they sit right down?
They first come in and sign in on the provider's list to sign in. That way the secretary knows exactly who's next, who showed up, where they are. She can find them in the spelling of their name on the schedule, and then check them off and make clear their insurance and just get the process started.
Awesome. So they know to do that, and then they sit down, and then who is going to take them back?
Then the medical assistant gets the approved record from the secretary, like not approved, but it was that she has coverage for that visit for the day. So we clear that first. Once she gives it to the medical assistant, then the medical assistant, depending on how busy it is during the day, actually just comes out into the waiting room and just calls her name.
Okay, so it's not your front desk staff that's the only interaction there with the front desk staff. It's
right.
Just a hello at the window.
Right. Just in the end, just to make sure that they have their insurance, and just to make sure that their insurance is up to date. So they go through all of the identification details.
Awesome.
They take a copay if they need a copay, that kind of stuff.
Okay. All right. So now we're gonna walk back as if we are a patient, if that's cool. All right. Come with us. All right, Dr. Witkowski, you lead the way.
Right. So after they check in at the front desk and they sign in and they get cleared, the medical assistant then comes out to the waiting room and just calls her name. She'll then get up and walk right through our door. And when she comes through the door, she goes back to the medical assistant laboratory. You can see the sign up on the wall.
Oh, we're coming up to it. Now, I'm walking through as the assistant, and I'm seeing here, there is this wall, and it says prenatal information. So they are giving some great information, which is
whether it's about events that are coming up, classes, about WIC referral forms, lab tests, and they explain some of the lab tests that they're going to be getting during their prenatal course, different important telephone numbers for different contacts that they may need during their pregnancy.
And as the as the NC, what I'm doing is I'm also making note of what I can see behind me. So I can see here, there's some, you guys can check this out. I have some additional desks, you know, and not much more information. It looks to me like it's a lot of administrative.
That's all administrative area up front where we have people that answer the phones, take messages, make appointments, you know, greet people at the front desk, and then as they exit, how they sign them up for their next appointment and how they say goodbye.
Awesome. So let's go back to where your medical assistant is going to be with them.
So usually in this lab
Oh,
that we have designed,
check it out.
she can check out more information on her computer at the desk that she has set up, at the lab bench that she has set up. They have vital signs taken in a chair here where they have their blood pressure. And she just really has the patient sit there and just talk to them for a few moments about why they're here for the day and maybe some of the questions that the patient wants answered that day. The scale back here where they get their height and weight so we can record their body mass index, something in our electronic medical record that gets watched by all of the insurance carriers. They really want to see that we keep certain vital signs on patients, and that's just one of them. So they do that on every single visit.
And again, as the NC, I'm taking a look because I can see here there is the 10 best foods up here from nutritianaction.com.
Everybody knows how much I'm into eating healthy and making all the right choices when you're deciding on your meals. And so I like to always put up reminders in the office about what I find online from excellent resources so that people can just see how simple it is to eat well.
Awesome. So we're spending some time in here, and then I'm going to ask, am I going back to the waiting room, Doc, or am I going into the exam room?
Again, it depends on how busy I am. When I'm really backed up, let's say doing a delivery, I get called to the emergency room. Sometimes they have them wait back in the emergency room. If there's some examining rooms open, and I typically use 3 examining rooms for the day, they might sit the patient in the examining room telling her that it might be a few minutes before I'm there.
And I just want to let you guys know that is one of our questions here, is how many exam rooms total, how many hallways, and how many patient bathrooms. So how many patient bathrooms?
Total here we have 6 patient examining rooms and 1 treatment room. We have 2 patient bathrooms. There are 2 hallways with 1 connecting hallway that has the provider offices.
Okay, and I'm asking this because I'm just in my mind thinking, where can we put some educational information? Where can we put some nutraMetrix branding information? Mm-hmm. So as I was here, I can see, let me, Dr. Witkowski, if you just, there is a calendar, and they do have some information. There is this, I don't know if this is familiar to anyone, this self-guide breast exam as appropriate for this GYN office. But otherwise, and I do know that they are in the midst of painting, so it's pretty sparse. You did take down all of your pharmaceutical information and other things that were up. There was a little bit more, but this is basically a clean slate.
Well, we kind of do like to keep it clean, so there's not too much distraction for all the patients, because we really want to talk to them and just let them tell us what they're here for, not to really jar their memory or try to influence them the way they're thinking. We just want them to open up to us.
So now, Doc, let's see what is next. So now we're going to the exam room?
Right. So usually from here, they will go into the bathroom. And in the bathroom is where they'll give a urine sample. You can see we have little urine collection cups. Nothing sterile, just of our routine urines. Sometimes if they want to check a pregnancy test or if I wanted to do a urine analysis, then I have that done. If you're a pregnant patient, every time you come in, we check your protein, we check your glucose that's in your urine. So that's why they need to collect that urine. So it's a pretty simple bathroom.
Sometimes you will get a bathroom tour. Very interesting, right?
And then the typical examining room looks like this, where we have a table set up where she can sit before even I get in the room. Just my stool that I use when I come and sit down and speak with them. As we turn this way with the new electronic medical records, I usually start the visit with me standing over here just to get the patient signed into my electronic medical record while she's just sitting in front of me on the examining room table. If there's a guest with her, we have a chair for either the husband or if they brought their mother or their friend who can just sit here, and there's a curtain for privacy in case that person doesn't want to see anything during the exam. They can sit into a little private section of the examining room.
Great. And again, this is pretty sparse, but there is some information on the back of the door, so some ability to, continue to brand and market. So now I'm done with my exam, Dr. Witkowski. Where am I going to check out?
So typically they just get themselves dressed and put back together again, and they walk right back out into the hallway. Mm-hmm. You can see the other examining room across the hall. The doors usually close like that, so they wouldn't see that. But you can see it's all very similar in here. Same setup, just maybe turn the opposite way. And they'll walk out this hall here and see the administrative person sitting at the front desk.
We're going to put this down so we can steady it, and we will close it out from being right here.
And they'll just check out, either make their appointment. If they need to have an additional test, then sometimes we'll check back in with the medical assistant to either get an ultrasound or a non-stress test or whatever other testing they may need, or even set up their next appointment for next year.
So in this particular appointment, there's no wellness area. There's no, that's not applicable. And checkout is with the same person. They're not really interacting back here with this administrative area. So as I'm going through as the nutraMetrix consultant in our next meeting, when we meet together, which is going to be our implementation meeting, I am going to bring what I suggest goes up for marketing information. I'm going to provide that to the office and to the physician at least the first time. I do like to just get it done and pay for it myself. When I started, you guys know my story, I was 20 years old when I went to my first NC training, and that wasn't always within my budget to buy, a whole wellness goals brochure set and everything for my offices. So I'll sort of work that out and set expectations. But we're typically teaching now, just get it done. I mean, this is like a roll up your sleeves. You're the NC. You're going in there for implementation. A lot of times you're the ones that have to get it done. Now, that took us 12 minutes. We took a little bit longer. It's a 15-minute clinic walkthrough. I mean, I appreciate Dr. Witkowski's time this evening. I don't typically do this exactly with the physician. I'll usually do this with a key office staff member, with the office manager, with the medical assistant. I may do this even in the initial discovery meeting. I might do it even a couple times, and you'd be surprised how many times you keep asking questions, what you discover about the office, the way the flow works. As staff tends to change, you might figure out those roles a little bit more. And I'm walking through the clinic. I'm looking for opportunities to market. I'm looking to see what it's like from the patient's perspective, what it's like from the practitioner's perspective. I'm trying to figure out people's roles. I'm trying to figure out where we can fit in, because then if we are going to offer products that are going to be in an inventory, where would I suggest that inventory goes? Where would I suggest posters go? What will go on the wall? And so that's what's all going through my head. Again, my name is Sarah Tugender, National Field Manager with nutraMetrix, hoping this is your most effective and efficient year yet. We'll stay on for just a couple minutes just to answer some questions. I see one that came in. Oh, great information. Thank you so much, Pam, for being on. I think we know her.
Yeah.
We'll stay on just for like 2 minutes because we don't want to take up too much of Dr. Witkowski's time this evening. If anyone has a question and you want to just type it into the chat. So I don't typically record this part. It's one of the perks of being on live.
Wow.
Is you get to stay for the question and answer.
This is my first meet on, too.
Oh, cool. Oh, Maureen, we'll record it. Don't worry. Thank you, Jane. I'm glad that you liked it. I hope it came out okay. We might redo it. And now that we've done it once, maybe we'll do it again in a couple weeks.
Always open to improvement.
Thank you, Maria. Thanks for being on with us. All right, if no one really has any questions, you can certainly tag me in the nutraMetrix Facebook group. Be happy to, do I need any extra room to implement this? Oh, I am sorry. What do you mean by you don't need extra room? Oh, if you can explain, WR Shopper, what you mean by the extra room. Maureen, you need the permission. So when I go in for the implementation meeting, I don't just put posters on the wall. Right. I'll suggest where they can go. Right. Would you
usually
say that?
The office administrator is really a good point of contact for that. because then they'll clear it with the different providers, whether or not they're employed providers or even if they're partners in the practice. They got to talk to everybody to make sure everybody's comfortable for what goes up on the walls. That's a great point. Don't just start going in there, taking over, and trying to put things up where you want them. Make suggestions, and then have either one of the medical assistants or one of the front desk person then show you who the administrator is, so you can talk to the person and even show them some examples of what those posters look like, the size of them, and how they look, so they know when they want to talk to the providers about getting them approved or not.
I'm going to answer this question from Jane. Where would you suggest the inventory goes? And this is if the health professional says we don't have the space. In this particular office, because it is shared amongst providers who do not incorporate nutraMetrix into their practice, there really hasn't been much of an inventory. In the past couple months, almost a year, we've kept a small inventory in where we showed you where the vital signs were, in a locked cabinet, taking up very little space. Maybe I would say on hand, there's, it's like a little more than a shoebox full. We just cleaned out an empty cabinet,
About a dozen
put a lock.
products are in there.
Right. And so we're ordering weekly at this point. Dr. Witkowski did hit the shopping annuity bonus pool, so he has had free shipping, which has made it a lot better and easier for you to order those products weekly, keep them in stock, and that has been really nice. He has an off-site nutraMetrix consultant who keeps track of the inventory and will place those orders. So, Jane, it's very exciting. It took a while to figure out exactly where it was going to go. We talked it out a little bit. Should it go in his office? Should it go there? So we just found somewhere that was a locked cabinet that there was extra space. I'm glad that helped.
And it's good that you take it out of the provider's hands and let the staff then, give the product to the patient and charge the patient either on a form or with their credit card or even cash. But it just takes all of that interaction and transaction out of the provider's hands. It makes it easier for them.
All right, guys, this has been really fun. It was awesome to see you on here. I should have this recording turned around hopefully by tomorrow night, so usually 24 hours. And I hope you guys have a good night. Thank you, Dr. Witkowski, for your time.
You're welcome.